Hi there, my name is Emily Paxman. I'm the VP of Analysis and Consulting here at KLAS Research, and today I am so glad to be joined by Paul Hess, who is our Senior Director over all of the post-acute segments here. I'm so excited to have this conversation with you. There is a wonderful report that first hit my radar almost a year ago at this point. I'd love it if you could, I obviously know all about it. I've lived it with you and we'll talk about that, but can you tell us a little bit about this report and how it fits into the post-acute segments you measure?
You bet. Yeah, this report about MatrixCare is the first of 4 reports that we'll do about the emergence of enterprise post-acute vendors who have gone out and acquired multiple solutions, multiple vendors to meet the various needs of post-acute care settings. We see this emergence, we see these vendors, a lot of energy and some considerable investments to go out and acquire these vendors. So we wanted to do reports on this and highlight the differences between them all and ultimately how well they're doing in supporting each of these care settings and the solutions that they've acquired.
This was a fun report for me to do with you because I've worked on our post-acute research in the past, but it's usually been, we're going to do a home health report or we're going to do a long-term care report. This one was fun because you even took the home care market and broke it down to home care, hospice, private duty, palliative care, and did the same thing on the long-term care side, and then added in a lot of the behavioral health and other type of LTAC facilities. So this was really looking at across the board, are there vendors who can do all of this, and what impact does it have on a provider experience? Are there benefits? Is that difficult? What does that look like? So that was so radically different than anything we've done before. And for me, that's why I found this report so fun. So you mentioned MatrixCare is one of the 4 that we did this report for. Who are the others that we are focusing on?
So the other 3 would be Netsmart, WellSky, and PointClickCare. Not necessarily in that order. We'll publish these as the data gets collected, but these are the 4 vendors that have really separated themselves in terms of acquiring different things. Yeah, and I'm excited as well to open the doors to these new care settings that we have not talked with before and understanding their story and their challenges.
Mm-hmm. That will be a lot of fun, but starting with just the MatrixCare piece, that was super intriguing because you mentioned acquisitions. There's so many acquisitions that they have made, Brightree, others that their competitors have made to get to this place where they have a complete offering across the entire post-acute market. One of the things that we went into this report with was we had the name enterprise platforms as for post-acute, and that changed a little bit as we got into it because there are benefits that we found from using one vendor across all these spaces, but these are really still disparate products today. This is a product suite, not necessarily a platform.
Right. Yeah, there was something we realized as we were going through the data and having these calls. Our scope was this, so we reach out to healthcare providers that are using MatrixCare in this case for more than one care setting, right? It could be home health, hospice, private duty, what have you, long-term care. And then if they are using it for more than one, we collect from them and just get an understanding of just how well this particular vendor supports multiple care settings and what are the advantages of having one vendor for all of these things. And are there advantages to it, right?
And I think that was what we determined is that there are some advantages. Now, it doesn't completely eliminate all of the challenges that market faces. In MatrixCare's case specifically, the relationship came through so strong in all of our conversations. So we had folks that were using them for 1 or 2 2 or more care settings, all the way up to 9 care settings. And we had an average of about 4 or 5. And despite these being different products, what they shared was, yes, there are challenges. Yes, we would like things to be better or different in the technology. But because we are working with people who have such great relationships and have such a great culture of customer success, we feel like we've been able to still get to a really good place, even though these are not fully integrated platform solutions.
Right, yeah. As a general rule, acquisitions are difficult to navigate and be successful in that, to have the customer satisfaction levels stay the same and not dip, to be able to develop these products on an ongoing basis and those things. And what we've seen from MatrixCare is they've upped the communication throughout this. And So that's really helped them to be successful, or their customers to be successful through this.
This is frankly one of the hardest things for me to keep track of. Can you just give me and everyone else out there an overview of what the MatrixCare portfolio looks like and how that acquisition strategy has unfolded?
Yeah, it is pretty involved when you dig into it. And first, let's be clear that it's ResMed that has done the acquiring of these solutions. MatrixCare was the chosen brand to go forward with many of these acquisitions. So over the years, we've seen ResMed acquire Brightree, and then MatrixCare. Brightree had their home health, hospice, private duty solutions. They had acquired Sonetto previously too, which is a private duty specific solution. So those have all been moved under the MatrixCare vendor name. And then MatrixCare had their own suite of solutions. Prior to the acquisition, they acquired Answers on Demand years ago, which is a long-term care senior living solution, life plan community solution. They had acquired SigmaCare, and they had their own MatrixCare solution as well. So there was several within that. And then also MatrixCare, Brightree, they've chosen to keep Brightree as a brand name for home infusion and for HME and some other technologies that we don't necessarily focus on in this report, but could potentially in the future. So that's hopefully I haven't missed anything, but there's several that have come up.
Well, that's helpful just to understand when we talk in this conversation, when we say MatrixCare, this is what we're really talking about, is all of this that has been put under that brand. So that's very helpful clarification.
Right, yeah.
Some of the benefits that those customers are describing were really interesting. One of the most frequently mentioned benefits is we love how it supports patient care across the continuum. And I know you and I looked at that and said, is this somebody who's talking about home health and hospice? Because those could potentially be the same solution. And that's not quite as impressive as having that be a benefit across multiple disparate care settings. And in a lot of the cases, that's who was answering that question, saying, yes, we do all of these things, but they are now a company who has a similar culture. And rather than feeling like we are trying to bring all these vendors to the table, they may be different products and have slightly different teams, but they are all committed to the mission of helping us get to a good place. So people were starting to get some benefits from that. This is still early in some of these acquisitions. We don't know how that's going to play out over the long term. What are some of the potential challenges that you think MatrixCare will run up against as they continue to try to go down this path? Anything that a customer or they should even know about success over the next 1 to 2 years?
Yeah, I think consolidation is going to continue to take place across post-acute, and to the extent that MatrixCare, these other vendors, can provide a true platform experience where interoperability is not an issue, that patients, as they go from one care setting to the next, they're not being required, or the nurse is not being required, or the front office person to re-enter all of their information from one system to the next. That'll be key for this to be successful. Also just prioritizing development and where to focus with these different products that they have, and how well they're supporting different care settings and those unique needs that pertain to those care settings.
Well, I'm excited to get into the other vendors and get to see what their customer experience looks like, see if we hear similar feedback in terms of the benefits and challenges there, or if we find that we are hearing something completely different and unique. And then going forward, I know that you have a lot of plans for looking at this market holistically outside of just this early series. What can providers look forward to in the post-acute space as far as KLAS research is concerned?
So as I said before, this will open doors for us to start collecting in new care settings and areas. We have currently reports planned for hospice and for private duty next year. We have plans for senior living and opening that up, both assisted living and memory care and independent living, those different care settings. Life plan communities or CCRCs, the rehab, outpatient rehab, inpatient rehab. So there's a lot coming down the pipe that we'll get to in the coming years. And so yeah, we're really excited to dig into that.
Well, excited, for us to get into the space, but also really exciting time for providers who are now starting to put these pieces together, and it's going to be fun to see what customer success looks like in this new platform-esque world that's developing. For those of you who would like further information about either this report or what we're hearing about in the market, you can always reach out to KLAS Research. Paul here, I know, has been very generous with his time talking to providers and vendors alike who want to get into the details and understand more. Visit our website, KLASresearch.com. Providers, all of that data is free for you to access. So you can view past reports we've published, this and the other reports as they're released, as well as the upcoming research we have through 2021 and 2022. Our mission is to make sure that you have the information to make the best decisions possible for your organization. So please don't hesitate to use that information and call upon us where we have opportunities to do more from you. Well, thanks for joining us today, Paul.
Thanks, Emily.